Friends, there are more serious issues. As a matter of fact, a decaying phenomenon going on in our healthcare system. And there's no reason for us to hide it anymore. Look at this young man. This young man died of medical negligence and was concealed. And as a matter of fact, I have no choice than to expose this because this young man deserved justice. He was the best graduating student of his set. Regrettably, he passed away and was concealed on circumstances I will expose to you in this particular video. It's quite unfortunate that our beloved sister, Chimamanda, lost her son in a circumstance described as medical negligence. And I wish our efforts, as we all out to see the betterment of our health care, will not give her palliative, as we did to Anthony Joshua. All we heard as the end of that story is that the driver was arrested and detained. Has that changed anything? The ambulance system in terms of emergency response and ambulance and all that, has anything been done? That's why I said same celebrity pacifier should not be maintained in the case of our sister. Vis-a-vis the fate of this young man and many other ones. This young man you see here, very brilliant young man with the big aspiration, which is the hope of the family. Lo and behold, he was on 72 hours call. During the call in their call room, he complained to his colleagues, "I'm not feeling so well. I'm not getting myself." They thought it is something you must continue anyhow it be. And the young man, they left him as they rushed out for emergency, attended to that emergency, and came back and saw this young man with ward coat without pulse, dead. Did you know that 2 months ago, the resident doctors all over the federal institution of Nigeria went on strike? And in that very strike or whatever they are pleading, within that very period, the entire medical centers and all that were all shut down. No media sector gave airtime, even for this very doctor to air what could be responsible for you not taking care of our people. Nobody talking about it. It was not a concern. Did you know there's a philosophy that says if you pay peanuts, you hire monkeys? Sorry to say it, but I have to. A medical doctor, resident doctor in federal hospitals, a register in a federal hospitals, and 320,000 as a salary. The one that are called senior registers earn about 450 to 500 and something, depending on how many years you have put into that. While there were consultants, the ones who know I want to see a consultant, friend, receive about 660,000 professors in medicine that are putting on 25 years, 30 years, some about to retire. Their salary is not up to 700 or just about that, depending on the number of years put in. Come on. Let's get to the roots. A medical doctor uses his brain to attend to a patient. And you know what? A doctor that can't pay the school fees of his children or even his rent, my friend, is a dangerous man. That individual had already been meted with medical negligence, waiting also to disperse accordingly. If Nigerians should know today, if it were not, I can tell you, that's why this campaign should be amplified to save our healthcare system. If it were not private hospitals, you won't see a single doctor. They will all be in Europe. That is the hospitals we want to bring down by all means. Come to think about this. If any person in the system, like in general hospitals, if there be some form of medical negligence or whatever ugly that happened that didn't follow professional principle, what will happen? The Ministry of Health, also the Nigerian Medical and Dental Council, will investigate and isolate this individual and give appropriate punishment or sanction required. But the hospital will be left knowing that this hospital is still saving lives, rather this cautionary measure will help other people to do more effective job, which is the right thing to do. Lawyers don't go and sue the federal institutions. But when it comes to the issue that has to do with the private hospital that have been in the very supportive arm, you begin to hear legal terms of vicarious liability because you are the one who employed that very individual. Therefore, you have to suffer because of that individual. But please, my heart is heavy because I know what it takes for anybody to build hospital of status that could help. I look at myself. I have a group of hospitals. And you know what? In this particular effort that employed over 500 direct and indirect employees. Please, let's take analytical reasoning. If in a situation, one out of the lots, you have the doctors, you have the nurses, you have a number of these individuals, and one person, by reason of whatever described as medical negligence, someone will take a decision and say, shut down the hospital, never consider, what about the other ones that are dedicatedly and passionately and practically doing their job? Would they be jobless? In a country we are looking for how to create jobs, to support the effort of the federal government, somebody is shutting down the hospital on the basis of one person. This something. Please, can we? I'm pouring out my heart. I want to see healthcare system of Nigeria work, and I'm very much optimistic through technology and a lot of things. It's going to work in a very short time. But let us not have this tear it down, bring it down mentality. If it can benefit me, let it benefit nobody. It's out of wickedness. We just have to carry this campaign. Our doctors need support. Our doctors need support. Legislators, both state and federal, should come to the fact. A doctor without a mental stability can do anything wrong. We need to look at this area. That the root cause. Anybody that is well paid will be afraid of losing his job. Or as a principle of economics. Very critical we look into this. And that's why I said this is not going to be a celebrity pacifier. The pain of our sister is there, but let it be a pivotal point where we can say it brought about the turnaround. And I think that will console her the more, that brought about a turnaround in healthcare. But while looking at that, look at it holistically. Together, I'm very sure. Please, I'm very sure, believe me, Nigeria will not remain like this. In a very short time, things will change. But let's not destroy the things we have built, or some of us have contributed to build with our own hands. It's not progress. Please share particularly to those our brothers and sisters abroad.